I'm Jennifer. I will be your nurse today. I will be conducting a head-to-toe assessment on you. That's everything from your head to your toes and everything in between. Do I have your permission to conduct this assessment on you?
Yes.
Okay, thank you. Um, First, let me tell you that the assessment is going to take about 20 minutes. I'm going to try to be a little quicker so I don't take up too much of your time. And at any point you feel uncomfortable or you're in any pain, just let me know, okay?
Okay.
I'm going to provide privacy for my patient. I'm either going to close the door if they have a curtain. I'm going to close the curtain. I'm going to do hand hygiene. Can you verify your name and date of birth for me?
Marcus Malcolm, June 1983.
Okay. I'm going to also verify that on his wristband. I'm going to raise my bed into a comfortable working position. I'm going to make sure the bed is locked. Can you tell me what today is?
Monday.
Okay. Can you tell me who the President of the United States is?
Joe Biden.
Okay. Can you tell me where you're at?
The doctor's office.
And can you tell me why you're here?
It's a regular scheduled checkup.
Okay. My patient is oriented ×4. As I'm asking him these questions, and one more question: do you have any allergies?
Not that I know of.
Okay. Pain scale from 0 to 10, with 0 being no pain and 10 being your worst pain you ever felt. What is your pain level today?
0.
Okay. As I'm assessing my patient, I'm looking at his level of consciousness, which is intact because he is able to answer my questions. I'm also looking at his skin, which is appropriate for his race and ethnicity. Also looking at his hygiene, his grooming. He's well groomed. He looks clean. He doesn't have any foul odors or anything like that. He is dressed appropriately for the weather. I'm going to go ahead and check I'm going to start with your scalp. Is that okay if I touch on you? Okay. I'm going to be assessing his scalp. I'm going to be checking for lesions, bruises, cuts, any infestation, and also alopecia. Okay. Everything looks good. His head looks round, smooth, and symmetrical. While I'm here, I'm also going to be looking at his bony prominences, which is behind his head. Everything looks intact. I'm going to move down to my patient's ears. I'm going to be looking for any drainage, discharge, anything like that. And if he had any drainage or discharge, I would coach it. And I'm just going to look at my patient with my pen light. Okay, no drainage. And I'm going to look in both ears. And while I'm here, I'm also going to look behind his ears for any skin breakdown. And also for any assisted hearing devices, which he does not have any. I'm then going to come to my patient's eyes. They look round, even, symmetrical. I'm going to have my patient pull down his eyelids so I can look into his eyes. Okay. His conjunctiva is pink and moist. His sclera is white. I'm also going to look for contact lenses, eyeglasses, things like that, and he does not have any. And while I'm here at his eyes, I'm going to do Perla, which that requires me to have my lights off. And I'm just gonna look for his pupils contracting, which is good. I'm going to turn my lights back on. I'm also going to do my cardinal filler gauge. I'm going to have my patient look at my pen light and look at my pen light. Do not move your head. Just follow my pen, okay? Okay, And I'm also going to do my, um, um, my, 1 second, y'all. I'm going to do my, accommodation test, okay? So I'm gonna have my patient sit up. Okay, I'm going to have you look at my pen light and then look at the far, something on the far wall. Okay, don't move your head. Look at the pen light and then look at the far wall. Okay, look at the pen light, and I'm gonna do that in each eye. And I'm looking to see if his pupils dilate, and they do. Okay, then I'm gonna come down to my patient's mouth. I'm going to check for any droopiness and if it's symmetrical, anything like that. I'm gonna look in his mouth to check if there's any missing teeth, any lesions, cuts, anything like that. Okay, everything looks intact. No lesions, no missing teeth, no dentures. The uvula is midline. The tongue is pink and moist. His gums are nice and pink and healthy. Okay. Okay, you can close your mouth. Can you smile big for me with your teeth? Okay. Everything is symmetrical. Like, again, no drooping. I'm going to come down to my patient's neck. I'm going to have you tilt your neck. I'm going to look for his trachea, and it is midline. While I'm here, I'm going to assess his JVD. I'm going to have my patient turn his head. He's still in a 45-degree angle. I'm going to have him turn his head to the left, and I'm going to assess for any distension, and I'm going to have you turn it to the right, and I'm going to assess for any distension. There's not. If there was, that could be an indication of fluid overload or heart failure. Okay, and while I'm here, I'm going to assess his jugular vein, and I'm going to do both sides, but not at one time, because we don't want him to pass out on us. Okay, with the bell of my stethoscope, I'm going to listen. Okay, and I'm listening for any bruit, crackles, wheezes, things like that. Okay, everything sounds clear. And also, I'm going to go back up to the ears. I'm going to do my hearing test on my patient. What I'm going to do is I'm going to say 3 things to you, and I'm going to have you repeat it back to me. I'm going to cover one ear, and then I'm going to do the same thing on the other side, okay?
1, 2, 3.
Okay.
1, 2, 3.
Okay. No hearing problems. Then I'm going to come down to my patient's shoulders. I'm going to test his strength in his shoulders. I'm going to have my patient raise his shoulders for me. Raise his shoulders. Okay. And while I'm here, I'm going to have my patient sitting up, and I'm going to do his, can you sit up for me? And I'm going to have him do his pronator drift, okay? What you're going to do is you're going to put your arms out with your palms up and your eyes closed, okay? And we're looking for any drifting, anything like that, and there's none. That's good. And while I'm here, I'm going to check you can open your eyes now, sir. I'm going to check his capillary refill, and it bounces back within 3 seconds. And here, I'm going to have him squeeze. No. I'm going to have you squeeze my fingers.
Okay.
I'm going to do a strength test.
Okay.
Go ahead. You can just squeeze my fingers. Okay. His strength test is the same bilaterally. It's good. Okay, you can let go. Okay, you lay back down, sir. And I'm also going to check his skin, again, for any bruises, lesions, IVs, things like that. And he doesn't have any. Then we're going to come down to his chest. I'm going to assess his breathing. his chest is falling and rising bilaterally to normal. I'm going to listen to his lung sounds, and I will listen for in 6 spaces on the front, and the interior 6 spaces, and posterior I will check 8 spaces. Okay. Okay. Lung sounds are free of wheezing, crackles, stridors, things like that. I'm going to have my patient sit up, and I'm also going to assess the back. One, I'm going to have you take deep breaths as I place. Okay, thank you, good job. And I will not zigzag. 4, 5, 6, 7, and 8. Okay, and can you lay back down? Lung sound really good. And while I'm here, I'm going to auscultate his heart sounds. Okay, and with this, I will do it with my bell of my stethoscope and the diaphragm. Okay, and each one will be for 1 minute. And just for video purposes, he is fully dressed, but if I'm doing this on a actual patient, they will not have any shirt on while I'm listening to any of their sounds. Okay, and then hold on, so I'm gonna have you lay back for me. Hold on, let me make sure. Okay, so I'm gonna auscultate. This is aortic, pulmonary, Erb's point, tricuspid, mitral valve aortic, mitral valve fifth intercostal space midclavicular. In here, I will auscultate for 1 minute on my bell and my diaphragm. Okay, everything sounds good. Then I'm gonna come over here to his abdomen. I'm gonna assess for his breathing. I'm going to auscultate. I'm going to auscultate his, well, first I'm going to look for any distension. And there's no distension. And I'm going to auscultate well, all 4 his quadrants. And I'm going to start with my right lower quadrant, and then my right upper quadrant, my left upper quadrant, and my left lower quadrant. Okay, and then I'm going to palpate, lightly palpate. And while I'm doing this, I'm going to ask the patient about his bowel movements. Have you, when's the last time you had a meal?
This morning.
Okay, and when's the last time you had a bowel movement?
Maybe a couple hours after.
Okay, and your urine, when you urinate, is it painful? Does it burn? Anything like that?
No.
Okay, and I'm checking he doesn't have any catheters or anything. I'm also looking, I'm gonna auscultate his, oh my goodness, I know what it is. Above his umbilicus, for brewing, and just right above his umbilicus. And I'm gonna auscultate for 1 minute. Okay, and then I'm gonna come down to his lower extremities. I'm gonna check his skin turgor, and it does bounce back. His skin turgor is intact. I'm gonna come down to your lower extremities. Again, I'm gonna check and see if he has any bruises, lesions, things like that. Do you walk with a cane or any assistive devices?
No.
Okay. I'm gonna have you do your range of motion. I'm gonna have you lift your leg and bend it, and then put it back down. And I'm gonna have you lift your leg, okay, and put it back down. And I'm also gonna do that with his arms. I'm gonna have you lift your arm and put it back down, and lift your arm and put it back down. And I'm gonna check his bony prominences on his elbows and the back of his heels. Okay, and you're good. I'm also gonna come down here and I'm going to check his tibial pulses bilaterally, which is good. I'm gonna come back up here and I'm gonna check his radial pulse bilaterally. Everything's good. And then I'm gonna come down here and check his pietus dorsalis pulse bilaterally. And then I'm going to do the flexion. I know your articulation, sorry. The flexion and dorsiflexion. I'm gonna have you put your legs together. I'm gonna have you point your toes to your chin. Okay? Okay. And then I'm gonna have you push back on my hands as hard as you can. Okay. His reflexes are really good, intact, strong. Okay. I'm gonna have my patient get up. You don't have to. I will have my patient get up to test his gait. Get up and walk to the door and back, and everything is intact. And this will conclude my head to toe assessment. I'm going to reassess the patient's pain, 0 to 10, 0 being no pain, 10 being the worst. What is your pain scale?
Still nothing, 0.
Okay, did you need anything?
Nope.
Okay, I'm going to lower the bed. I'm going to, at its lowest position, I'm going to put the call light in reach. I'm going to do hand hygiene and document. And that is it. Thank you very much for letting me conduct this head to toe assessment on you.
Thank you.
And if you need anything, just let me know.
Will do.
Okay.